Diane, this is a shout out to you because you asked about plantar fasciitis, and a lot of people have plantar fasciitis. I've had it myself. It's a very, very frustrating condition. Easy to diagnose. The person's medial heel is really tender. If you dig in here, they say, ouch, 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 ouch. The other very common symptom is you wake up in the morning, you can barely walk. You get a few steps in and then you can walk a little easier. So plantar fasciitis creates havoc with your feet because we rely on them to get around. And if you sit at a desk too long, you'll get out of the chair and it hurts to walk for those first few steps. So it's actually not that difficult to resolve. We've had cases of plantar fasciitis that were lasting 5 years. They came, we used the MIAC treatment, now they don't have it anymore. It's amazing that MIAC treatment really works. Dr. Dave's going to explain some more about plantar fasciitis and the Three Stooges.
Yeah, there's Three Stooges. But what it does is this connective tissue makes an arch, kind of like a bow and arrow. So you see that, and this holds this up. So it pulls this tissue in like this, pulls this tissue in like that. When it doesn't do that, this tissue starts to tear here. And that's your plantar fasciitis or anywhere along here. Initially, when you first step on this scarred. And when you step down, that pain is this re-tearing. And now that it's torn, you can walk. As soon as you get off it, it scars up, you re-tear it. So we really need to break that cycle. That MIAC machine works. Orthotics, which would be something that you could wear, say, on the foot, will actually help maintain and hold that arch. They also have a heel spur correction that can be put into here so that if you've got this little bony growth thing that's grown right here, helps with that also. So there is hope, and you don't have to suffer from plantar fasciitis. In your case, you'll just have to come to Phoenix.
Bye, Don.